If you have lumbar spinal stenosis, you've probably been told your only real options are pain meds, injections, or surgery. But here's the part no one tells you. A small set of simple exercises can reduce pressure on your spine in minutes without pills or procedures. I've helped people just like you get fast relief using 5 safe seated and standing exercises you can do at home no matter what your age. In this video, I'll walk you through each exercise step by step, explain why they work for stenosis specifically, and at the end, I'll show you the common movements that actually make stenosis worse so you can avoid them completely. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. I help people get relief from disc bulges, sciatica, pinched nerves, and chronic spinal issues without surgery or medication using chiropractic corrective care. Subscribe now if you want simple exercises and proven tips to help you feel better, move better, and stay pain-free. Before we get into the exercises, let's quickly clear up what spinal stenosis actually is, because this will explain why the exercises in this video were chosen very intentionally. Lumbar spinal stenosis means there's a narrowing in the spaces of the lower spine. That narrowing can put pressure on nerves, which is why many people feel back pain, leg pain, heaviness, tingling, or weakness, especially when standing or walking for long periods. The key thing to understand is that certain positions increase that pressure while others reduce it. And that difference is huge when it comes to pain relief. That's why flexion-based exercises matter for many people with lumbar stenosis. Flexion simply means gently rounding or bending forward. For a lot of patients, this position opens up space in the spine and takes pressure off irritated nerves. That's why symptoms often feel worse when standing tall or arching backward, and better when leaning forward, sitting, or resting over a support. These exercises are designed around that principle. Now, not everyone with stenosis tolerates movement the same way. Some people feel relief when exercises are done seated, others do better standing, and some can comfortably do movements laying down. That's normal. In this video, I'll give you options for each exercise so you can choose the version that feels easiest and gives you the most relief. You don't need to push through pain. You don't need to do every variation. You just need to do the one your body responds to the best. Let's start with exercise number 1, seated forward flexion, one of the simplest and most effective ways to reduce pressure in the lower spine and calm symptoms quickly. This exercise is for reducing pressure in the lower spine and calming nerve-related symptoms caused by lumbar stenosis. We're doing this one first because it's gentle, accessible, and often provides relief almost immediately. When you bend forward in a seated position, it increases space in the spinal canal, which can take pressure off the irritated nerves and help settle pain in the back, hips, and legs. The result you may notice is a decrease in stiffness, less heaviness in your leg, or a gentle feeling of relief in your lower back. Some people feel the change right away, while others notice it after a few repetitions. What you should feel is a comfortable stretch or a sense of unloading in your lower back. You should not feel sharp pain, increased symptoms, or strain. If you do, ease off and reduce your range of motion. To do this exercise, sit on a sturdy chair with your feet flat on the ground and your hands resting on your thighs. Gently begin to lean forward, allowing your spine to round naturally as you slide your hands down towards your knees or shins. You don't need to force movement or reach the floor. Let gravity do the work. Once you reach a comfortable position, pause briefly, then slowly return to an upright position. That's 1 repetition. Perform 10 reps, moving slowly and in control. Aim to do 2 to 3 sets of 10, and you can do this exercise once or twice a day, especially when symptoms feel worse after standing or long periods of walking. As you do this, focus on relaxed breathing and smooth motion. This exercise is about creating space and relief, not pushing your limits. If seated forward flexion feels good, it often sets the tone for the rest of the routine and prepares your spine for the next movement, which builds on this same idea of gentle, controlled motion. Next, we'll move into seated pelvic tilts, which help improve spinal movement and reinforce this pain-relieving position in a slightly different way. This exercise is for improving gentle movement in the lower spine and reinforcing that flexion position that often feels relieving for people with lumbar stenosis. We're doing this one after a seated forward flexion because it keeps you in a safe, supported position while also encouraging the spine to move more smoothly rather than staying stiff and guarded. You may start to notice there is less tightness in your lower back and better control of your spinal movement. Over time, this can help reduce that locked up feeling and make everyday movements like standing up or sitting down feel easier. What you should feel is a mild rocking motion in your pelvis and a gentle flattening and unflattening of the lower back against the chair. This should feel controlled and comfortable, not forced or painful. To do this exercise, sit on a chair with your feet flat on the floor and your hands resting on your thighs. Start in a neutral position, then slowly tilt your pelvis backward by gently rounding your lower spine as if you're tucking your tailbone underneath you. Hold that position briefly, then slowly tilt your pelvis forward. But with spinal stenosis, we don't want to move too far into extension, so stop when you reach a neutral position. Then move back and forth between these two positions in a smooth, controlled way. That full back to neutral motion counts as 1 rep. Perform 10 reps, aiming for 2 to 3 sets. You can do this exercise once or twice a day, especially if your back feels stiff after sitting for long periods. As you do pelvic tilts, focus on control rather than range. Small movements are often more effective than big ones. This exercise helps your spine stay mobile and prepares you for the next exercise, where we'll be transitioning from seated to standing in a way that supports your back instead of aggravating it. Let's move on to the exercise number 3, sit to stands, an important exercise for daily function and confidence with movement. This exercise is for improving strength, mobility, and confidence with one of the most important daily movements, getting up from a chair. For people with lumbar stenosis, standing can sometimes trigger pain or leg symptoms if it's done quickly or with poor mechanics. We're doing this exercise to teach your body how to transition from sitting to standing in a way that reduces spinal stress instead of increasing it. You may begin to notice better control when standing up, less stiffness when you first rise, and an improved leg strength without aggravating your back. What you should feel is your legs doing most of the work, with your back staying comfortable and supported. You should not feel a sharp increase in back or leg pain. If symptoms increase, slow the movement down or reduce how tall you stand. To do this exercise, sit near the edge of a chair with your feet shoulder-width apart and flat on the floor. Gently lean your upper body slightly forward, keeping your back comfortable, and push through your heels as you start to stand up. Once upright, pause briefly, then slowly lower yourself back down into the chair with control. Avoid arching your lower back at the top. Stay tall but relaxed. One full sit and stand counts as 1 rep. Perform 10 reps and aim for 2 to 3 sets. You can do this exercise once or twice a day, especially if you notice stiffness or difficulty when standing after sitting. As you do this movement, focus on smooth control rather than speed. This exercise bridges the gap between seated relief and standing tolerance, which sets up perfectly for the next exercise, where we'll take the same flexion-friendly concept into a standing position. Let's move on to exercise number 4, standing forward bends. This exercise is for helping you tolerate standing with less discomfort while still using a flexion-based position that many people with lumbar stenosis find relieving. We're doing this one in a standing position because daily life requires you to be on your feet, and this exercise teaches your spine how to unload and reset while upright instead of pushing through pain. You may begin to feel a reduced stiffness in your lower back, less leg discomfort after standing, and a quicker sense of relief when symptoms start to build. What you should feel is a gentle stretch or decompression through the lower back and hips. You should not feel sharp pain, dizziness, or worsening leg symptoms. If you do, reduce how far you bend or return to a seated position. To do this exercise, stand with your feet about hip-width apart and your knees slightly bent. Slowly hinge forward, allowing your upper body to relax and your spine to round comfortably as your hands slide down your thighs towards your knees or shins. You don't need to touch the floor. Pause briefly in a bent position, then slowly return to an upright stance, stopping at neutral rather than arching backward. That counts as 1 rep. Perform 10 reps and aim for 2 to 3 sets. You can do this exercise once or twice a day, especially after periods of standing or walking. Move slowly and breathe as you go. This exercise gives you a way to reduce symptoms while standing, which makes it a great bridge into the final movement, one that's done lying down and often feels especially relieving for the lower back. Next, we'll finish with exercise number 5, single or double knee to chest. This exercise is for gently opening up the lower spine and reducing nerve pressure in a fully supported position. We're ending with this one because it's often the most comfortable for people with lumbar stenosis and works well as a cool down or symptom relief exercise, especially if pain or stiffness is more noticeable towards the end of the day. What you may notice is a sense of relaxation in the lower back, reduced tightness, and calmer leg symptoms. What you should feel is a gentle stretch across the lower back and hips, along with a feeling of unloading or decompression. You should not feel sharp pain or increased nerve symptoms. If pulling both knees feels too intense, stick with the single leg version. To do this exercise, lie on your back with your knees bent and your feet flat on the floor. Start by bringing one knee towards your chest, using your hands behind the thigh or over the shin to gently assist the movement. Hold briefly, then return your foot to the floor. For the double leg version, bring both knees towards your chest at the same time, keeping your shoulders relaxed and your breathing steady. You don't need to force the knees in close. Let the movement stay comfortable. Each knee pull counts as 1 rep. Perform 10 reps, aiming for 2 to 3 sets. Again, you can do this exercise once or twice a day, especially before bed or when your back feels tight or irritated. As you finish this exercise, take a moment to notice how your back feels compared to when you started. These 5 exercises work together to reduce pressure, improve comfort, give you options based on what your body tolerates best. Now, let's talk about the bonus, because this part is just as important as the exercises themselves. If you have lumbar stenosis, doing the right exercises helps, but doing the wrong movements, even accidentally, can quietly undo your progress. And this is where a lot of people get stuck. They're consistent, they're motivated, but they're unknowingly aggravating their symptoms with exercises and activities that increase pressure on the spine. The biggest thing to be cautious about is repeated or sustained back extension, meaning arching your lower back. Movements like back bends, prone push-ups, and exercises that push your spine into exaggerated upright or arch positions can increase narrowing of the spinal canal and flare up leg or back symptoms. For many people with stenosis, these feel fine at first and then worsen pain later, which makes them especially misleading. Another common issue is excessive twisting or rotation, especially when it's combined with lifting or bending. Rotational movements can irritate sensitive joints and nerves in a narrowed spine, even if they're done slowly or with light resistance. This doesn't mean you can never rotate, but aggressive or repetitive twisting is often not tolerated well. Finally, be mindful of long, uninterrupted walks or prolonged standing. While walking is often recommended, many people with stenosis notice symptoms build the longer they stay upright. Instead of pushing through, break walking into shorter intervals and use gentle forward-leaning positions like resting your hands on a counter or walker to give your spine relief. The key takeaway is this: relief from lumbar stenosis isn't just about adding the right exercise. It's also about removing the movements that increase pressure and irritate the spine. When you can combine both, symptoms often are much easier to manage and daily activities feel far more doable. Now you have a lumbar-specific daily routine you can safely do at home. Nothing aggressive, nothing complicated, just simple exercises designed to reduce pressure, calm symptoms, and help you move with more confidence. And the most important thing to remember is this: even small, consistent movements, done the right way, can make a real difference over time. There's always something you can do to feel better. If you found this video helpful, please like and share it so more people dealing with spinal stenosis can find safe, practical help instead of feeling stuck or discouraged. Now I want to hear from you. Which exercise gave you the most relief? Was it a seated pelvic tilt, or was it the knee to chest stretch? Leave a comment and let me know. I read them, and your experience helps others watching the video as well. And remember to subscribe to my channel if you want simple exercises and proven tips to help you feel better, move better, and stay pain-free. Now, the next video you should watch is this one. If you want to understand why leg pain gets worse with walking and standing, go watch this video next.